We are joined by Dr. Diego Coira, who is the chairman of the Department of Psychiatry and Behavioral Medicine at HackensackUMC. I was pleased to join the good doctor at a conference at Hackensack just recently. Get this full name, it's important. It's International Integrative Behavioral Health Symposium, Epigenetics, Neuroplasticity, and Integrative Medicine, the third revolution of psychiatry. Doctor, the third revolution, the first was?
Well, first we had Freud with his theory of psychoanalysis, the beginning of the last century. We consider that the first revolution in psychiatry. In the 1950s, with the discovery of thorazine, the first antipsychotic, we moved from psychoanalysis to psychopharmacology. And we thought that all mental illness was just a chemical imbalance that was going to be fixed with pills. And both of these revolutions did not produce what we were expecting, which is an understanding of mental illness and a cure of mental illness. So now we believe that with the new fields of epigenetics.
What is epigenetics?
Epigenetics is the ability that the organism has to change the expression of the DNA by changing your lifestyle. So even if you're born with genes to develop certain diseases, diabetes, heart disease, depression, you may be able to stop the expression of those genes by changing your lifestyle.
Changing your lifestyle.
One example is the Mediterranean diet. It was a study done in Spain a couple of years ago, that showed that people that adhere to the Mediterranean diet,
which includes what kind of food?
Includes fruits, vegetables, fish, red wine, a little bit.
A little bit?
A lot of water, yes. And moving, dancing, and eating with your friends. It's a style of life, it's not only a diet. But what it shows is that these individuals had a less incidence of diabetes, heart disease, depression, and Alzheimer's.
And Alzheimer's? A direct correlation?
A direct correlation.
So, you know, in the conference we had, Doctor, when I was talking to you in front of everyone, one of the things you said to me that I want to make sure we talk about this and talk to everyone on public television about is you feel that overmedication is going on.
Yes, there's a problem. We did a study ourselves at Hackensack, and Mitch Grady, my colleague, and I in 2002. The average patient, we studied 1,000 admissions to our inpatient unit. The average psychiatric patient was coming in on 4.5 medications.
In 2002?
Yes.
4.5 medications,
yes.
Go ahead.
And there's no evidence that 4 medications were better than 1. So
but why was the average patient getting 4.5?
We get into a system of just medicating symptoms. If someone can't sleep, you give them a sleeping pill. They're anxious, and you give them Xanax. They're depressed, you keep adding pills. And the problem that we get into is that most of the time when these patients come to see me, what I'm seeing is the side effects of these medications.
The side effects?
Right. So we were able to cut this down to our average patient goes on 1.8 medications. And we've been able to maintain that for 13 years with good success.
Do you get resistance?
I do.
From whom? Patients and colleagues?
I think colleagues have been trained in the last 20, 30 years to prescribe medications. It's hard to find psychiatrists that can listen and understand the individual anymore. So it's not their fault. I think they've been trained that way. And we as a society, we want the quick fix.
Give me the pill.
Give me the pill and symptoms are going to go away. We know that's not going to be the case. Now, through changing your life, like what I was mentioning before, and then the concept of neuroplasticity, we thought that about 23 years of age, your brain stopped growing.
And we thought at 23 years of age, that's it for the brain.
That's it for the brain, and from then it's down the hill. We are all going to develop Alzheimer's at some point if we live long enough. Well, now we know that the brain is very plastic. The brain can regenerate neurons if you stimulate the brain, and things like learning a new language, music, exercise, mindfulness can grow your brain. There's studies showing that if you do mindfulness.
Yeah, but Diego, you and I have had this conversation, and I've told you, without going into a lot of detail, there are people in my family that are dealing with, some Alzheimer's, dementia issues. So I say, Diego, so that's it. It's in the genes, and I guess I get tested, and I'll find out what are the odds you know, that my sisters and I, and you say, well, wait a minute, hold on. There are some things that we can do.
There's things you can do. And it has all to do with your lifestyle. And there's 3 basic brain health techniques that you can use. You have to exercise daily, be mindful, learn how to do mindfulness meditation, because studies have shown that people that meditate 20, 30 minutes a day, their telomeres, which is the part of the DNA that has to do with aging, are elongated, so they live longer. Their brains are larger.
What about stress?
Stress is, in my opinion, the common cause of all chronic illness, including heart disease, diabetes, and depression.
Common. Why?
I think that stress starts a cascade of events in the brain and produces cytokines, which are toxic to the brain, that can cause these chronic illnesses. See, we see mental illness as separate and different from physical illness.
Is it?
And I see it differently. In my opinion, all are physical illnesses. Mental illness is an illness of the brain. I have sometimes in the emergency room, a physician tells me the patient is medically clear to go to psychiatry. So how could it be medically clear if the most important organ of his brain, the brain, is not functioning? So that's a problem that we have, the way we look at mental illness.
Interesting, on so many levels. The third revolution in psychiatry, before I let you out of here, just a little while back, you were the honorary chair of the designer show house that Hackensack has. What's the designer show house? Why are you the honorary chair, and why does it matter?
Yes, well, it matters because this is
We're looking at visuals of it as you talk right now.
A fundraiser, and it's a
beautiful home.
The proceedings go to my department to develop our programs and our research. It's going to go on until November. It's going to go on every day. People can come in and visit, and they pay a fee to go in and see this beautiful home. And
all the proceeds go to the Department
of Psychiatry.
And you're the honorary chair?
Yes.
Good stuff. Diego, every time I've talked to you offline or on camera, I learn something new, and more importantly, our audience does. So I want to thank you for joining us.
I want to thank you for your support, Steve, and thank you for coming to our conference.
We'll keep talking. Stay with us. We'll be right back. Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, Wells Fargo, New Jersey Resources, Horizon Blue Cross Blue Shield of New Jersey, Berkeley College, New Jersey Sharing Network, and by MagnaCare. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.